All right, so let's get started. So, like Chief Lombardi of Seymour up there, uh, I thought like weeks ago when it was announced in this vaccination rollout for COVID-19, I was under the impression that first responders, which included firefighters, volunteer or otherwise, were among the group 1A or whatever the classification is. I posted a story on the Valley Indy Facebook page, and I was immediately told by a bunch of firefighters that that's not the case. So, if you could bring me up to speed as to what's going on with vaccination for volunteer firefighters.
Absolutely. And just first, Eugene, I just want to thank you for having us all on. So to go along with your question, originally when the vaccination first came out, the first vaccination was given out in December 14th of this year, of last year rather. Um, Originally, when the phases came out, there was phase 1A, phase 1B. Originally, all first responders were lumped into the first phase. What happened after that, because obviously the firefighters poured in, with the second phase, they restricted it to medical first responders. So basically, a better understanding of that would be, if you're a fire department and you don't respond to medicals, so if you got a call for chest pains, a lot of the Valley firehouses do not respond to that. It's done by EMS. So, unless you're called to a scene by EMS, you're not really a first responder, a medical first responder. And then some firefighters were vaccinated based on what they call an R1. And I'm sure Dave can talk about that a little more. So if you have the R1 certification for the town, basically that is your ambulance service. So that is your EMTs. If you hold that certification or that license, it is, your personnel can be vaccinated. So
Okay,
obviously, for like the Seymour Fire Department, we don't hold the R1.
Okay, so there were at the very beginning of this in December, there were some firefighters who were able to get vaccinated. I'm talking about volunteer firefighters in the Valley, but they had to have that R1 certification, you're saying.
Correct. And I'm sure some firefighters did sneak in under, not having the R1 prior to the second phase starting. Once the second phase starting, they clarified what they meant by a first responder, them being the state.
And when they clarified it, that took like what, your entire department out of the running at that point?
Well, we don't respond to any medical. So, the only medical I'm just speaking for Seymour. The only medical that we respond to is if, there's a lift assist, some type of motor vehicle accident that is, has injuries with extrication. So we don't respond to anything but that. And, so that kind of takes us out of the loop as far as, we're not going to, bee stings or chest pain or, stuff like that.
But I thought, and then maybe this is my ignorance, but I'm just talking as a layman and an observer once in a while to firefighters and ambulance services showing up at things. I don't differentiate between like the ambulance crew and the firefighters necessarily, because it seems to me like it's the same group of people, especially in small towns like Seymour or Derby. But what was the logic of separating this? And don't you respond to a lot of medical calls? I mean, every car accident, don't firefighters have to get close to the people that are hurt and need assistance?
Absolutely. I mean, we responded to a car accident last Saturday where an individual had, the car had slipped on the ice and went into a snowbank. There were no injuries. When we got there, the person in the vehicle said, "Stay away, I have COVID."
What do you do? What happens in that situation?
Well, in that situation, she ended up needing some type of medical evaluation. And obviously, we kept our distance, kept our mask on. There was really no need for us to, she didn't need to be extricated out of the vehicle or anything like that. But these are the things that we're running into, and we're not vaccinated, and it's definitely an issue. I mean, there's some kind of disconnect between what's going on in the state and what's really going on in the state.
By that, do you mean that the governor or the governor's people or whoever came up with this policy, Department of Health, that they don't understand how volunteer firefighters in our towns respond directly to these scenes? Like, what's the disconnect? I'm trying to.
Can I jump in quick before I have to duck off? If you don't mind, Mike, is that all right?
Yeah, absolutely, buddy.
So yeah, Eugene, the problem is that basically the state came up with the delineation that what a first responder is based on their medical responding. So like Mike mentioned the term R1, it means that you're licensed through the Department of Public Health as a licensed medical first responder. So there's different levels of the R1. So R1 means just first responder, no ambulances. R2 is a transporting ambulance, and so on and so forth. The problem is most of your volunteer fire departments don't hold any type of official medical certification. The problem is like you said, just the other day in Derby, we had a person who was in cardiac arrest, and members of the fire department responded to assist the ambulance, or we respond to car accidents, or even you're going on, standard service calls such as CO calls or, gas leaks in structures, and you're getting there and the people are telling you, oh, we're COVID positive, or it's adding, our workforce is completely volunteer. I have nothing as a department head to make people come to work. And when you have a situation like this pandemic, it really could affect us where our members don't want to respond because they're not protected. And it becomes a bigger issue from that standpoint. And I really do think it wasn't intentional. It was more of an oversight by the state. They in a better, in an effort to redefine things and not really understanding what happens on the middle of Main Street, Connecticut, they came up with that medical first responder delineation, but they don't realize that the majority of us wear multiple hats at an incident. A lot of the fire departments cut somebody out of a car and hand it off to the ambulance because the ambulance crews aren't trained. Now, from the standpoint of Derby, I luck out because of our relationship with the storm engine company and the ambulance corps, where most of our members belong to the ambulance corps and are medical first responders. So I'm not as bad of a situation as, say, Seymour is or Shelton or Ansonia, but it's affecting us from the standpoint of retaining our volunteers because you can't protect them and they feel that they should be protected.
Yeah, I had no idea that this was happening. What about, you all have mayors and first selectmen. We have state reps, state senators who are supposed to be there representing us, and more specifically representing the volunteer fire departments here. What have they said? Have you reached out to them, and what have they said? Whoever wants to take that.
I've spoken to our delegation at it, and they sympathize and they're working on it. As we know, it goes through the governor's council. So that seems to be where the hang up is.
Yep.
And Chief Lombardi, what about you up there in Seymour?
I've definitely had a lot of conversations with our first select woman, Anne-Marie Dragonis, and she totally understands, and she's a huge advocate for first responders, and I know she has sent emails, made phone calls. We're trying to get the right answer as well, because it's not just the fire department. It's also the police department in Seymour has not been vaccinated.
I thought police officers were vaccinated. You said they're not?
Not in the town of Seymour.
And is there any idea when they're going to get vaccinated, or we're all just we all fall under this age?
Well, now if you go, from my understanding, if you go from what the governor said on Monday, now it's just going to all fall under age. So like the thing that concerns me, and I'm sure some of the other chiefs would agree, is a good majority of my membership is in their 20s and in their 30s. So I believe May, your age to go would be 18 to 35. So that's a long time away. Again, the first vaccine came out in December, and here we are talking about vaccinating our firefighters in late May.
And I have questions, but I want to throw it out to everyone else to make sure that if someone wants to say something, they have the chance to, and it's not just me guiding a conversation on a subject I know nothing about. Does anyone else want to chime in on the situation and how it's affecting what you do?
Yeah, this is Quinn Levy, Assistant Chief in the Seymour Fire Department. It's definitely bringing down the morale for sure with some of the firefighters, thinking that they were able to be in line for the vaccination with being first responders. Like some of the other chiefs had said on this conversation, we deal with a lot of our patients or victims firsthand before we hand them off to EMS. especially with car accidents. We're the ones that are the professionals with cutting them out or getting them to safety and getting them into the care of EMS. So, it's kind of discouraging where we are labeled as these professional, dominant, firefighters, where we can come in and handle our situations. But in a situation where the pandemic is happening, we're kind of being overlooked in a sense as a volunteer organization. I'm sure I'm pretty much speaking for every other chief that's on here and some of the other chiefs we have talked to verbally face to face, but we really, really need to try to make a push, and whether it be the state to understand the Naugatuck Valley Health. I know our first selectwoman, Anne Marie Dragonis, she's definitely an advocate for us, like Chief Lombardi said, and she, wants to try to do what she can to get us all vaccinated. But, the way that the cards were dealt to us, and given the governor's leadership and guidance on the next phases up and coming, it's kind of disheartening to see that, we're being overlooked again and being passed by. So as far as like from the firefighters and talking with them personally, it's they're discouraged about it. And we've received a lot of phone calls, fielded a lot of questions from our personnel, and we have to stand strong as leaders and keep them in the right mindset so that they can perform their jobs. And not only that, but we're also losing personnel coming out because running the risk of getting infected with the coronavirus. So
yeah, is that having a noticeable impact? I mean, this has been dragging on it'll be a year in a couple of weeks. And I know at the very beginning, I was doing stories of all the extra gear and protections, and firefighters wouldn't go to in a truck or apparatus or whatever you call it. They were wearing their masks at times when they previously would not. Are you still doing all those protocols? Are they still in place? And is that another thing that's sort of weighing the firefighters down?
Oh yeah,
In a literal and figurative sense?
Absolutely. I mean, Chief Lombardi has sent out numerous emails to personnel. I'm pretty sure Derby has been communicating with their personnel as well. But, with trying to protect ourselves and doing every precaution that we can take to make sure that our guys are safe, men and women, whether it be obviously trying to stay socially distanced as much as we can, wearing our face masks, going into some of the heavy areas where COVID is high.
That's right. You have a
putting
nursing
some of
home.
our-
Seymour has a nursing home.
Correct.
at the
Yeah,
beginning of
we've
okay.
told
We have
some
quite
of
a
our
few.
firefighters to go on air if the COVID positivity rate is high, just on air packs, so that we can stay that much more safe.
And then there's a whole decontamination.
Correct.
You start putting firefighters in buildings like a Shady Knoll and Seymour, where numbers are a little higher. Now those firefighters come out, that equipment's got to be decontaminated, or they ride back to the firehouse in the trucks. Those trucks got to be decontaminated. So the whole way that the fire service, regardless if it's the valley or not, the whole way that the fire service has had to change their business approach is incredible. We even limit the amount of personnel on a truck. Most of our apparatus holds six firefighters. We've limited it to 4, just so to make sure that they're not, there's a firefighter at every door and the guys aren't sitting next to each other. And just as Chief Levy said, guys wearing their masks, and we bought these special guns that spray, the chemical in the truck, that clean the truck after every call, after every drill. Again, it just, the way we have to do business now is crazy.
And how many roughly active volunteers do you have in the Seymour department up there?
I would say probably close to 80 to 100. We do have associate members, veteran members. So like a veteran member is a firefighter who's put in like 35 years and wants to do fundraising but doesn't want to go to fire calls and that kind of stuff. So but we're whether they're active firefighters or not, we're still, as chiefs, are obligated to protect our people. And by not being vaccinated, we're not doing that. And that's tough for me personally. That's tough for me to swallow. As the chief said before, when this first was going on, our phones were going off like crazy about the vaccination, and we didn't have answers. I still feel that we kind of don't. I don't understand why certain parts of the state that have different health districts have been vaccinated.
Okay, let me ask
we
you
are not-
about that. You're saying firefighters in some other parts of the state have been
Yeah.
vaccinated? And how
Yes.
do you know that?
Just reaching out, talking to them. A lot of them so when the first phase kicked in, prior to the state determining that a first responder had to be some type of certified medical first responder, there's a system, the VAM system. They loaded their names into the VAM system and got in. And then, when the second phase came and the governor put a description on what a first responder was, that's when everything kind of stopped.
And then how did, and I don't mean this in an accusatory way, but when that first VAMS system opened up, was there an effort to try to get the firefighters vaccinated in Seymour, or how did it work at the very beginning?
No, I think, part of it was that it was so unclear of what was going on and everything was happening so fast. We did not do that.
And then one thing I noticed, and it kind of took me aback because I don't do any reporting on volunteer firefighters angry or frustrated at something. It's kind of a rarity in my experience, at least on the local news side. I saw you had a post on my page, maybe calling out is the wrong word, but you tagged the Naugatuck Valley Health District and basically said, what was the point of that? I don't want to put words into your mouth.
Yeah, I mean, I did take a little flack for that, and that's fine. But I just, I feel like we've kind of been left behind a little bit, and it's very disheartening. We're all volunteers. So when the bell goes off, we're leaving our families to do this for free, and to not be vaccinated, it's very disheartening. I mean, and not only that, but the town of Seymour has their own the COVID clinic. Where you're getting the vaccinating clinic is in the town of Seymour. I mean, it baffles me.
Almost like right across from one of the fire departments, essentially.
It's on the
downtown.
Broad Street Bridge in the community center. And I just I don't understand where the disconnect is. There's some kind of disconnect. This should not be this difficult to vaccinate our firefighters. And not just Seymour. I mean, all the whole valley. I mean, these guys and these girls, they're giving a service for free. The least we can do is protect them. I mean, that's
absolutely.
And then Chief Lombardi, I had asked, that somebody else can jump in, I apologize, but I had asked how many members you have, 80 to 100 active, you had said. And do you have any idea how many have been vaccinated up there?
4.
4.
Wow.
4.
Okay. And I had interrupted somebody.
That's the correct number, right? Yep. Yeah. So we had, there had been some vaccinations that, you have to schedule an appointment basically. And apparently if you don't show up for the appointment, once the vaccine's taken out of the freezer or the fridge, if you will, you still have to use it. So there was one day where, a couple people did not show for the vaccination, and, got reached out to my deputy chief that they had some vaccinations. So we, kind of scrambled and said, okay, well, who's home? Who can get to the community center in 10 minutes? And, but I mean, 4 people have gotten it. Some people have gotten it, obviously, our volunteers that are our career staff in other towns have gotten it. And I've encouraged, if you're 75, 65, obviously get on the, you're eligible right now, get that done,
We've had several, some of our older veteran members that, God bless them, they've done their service to their communities for 30 plus years that are starting to get vaccinated now because they fall within the phase of, the current phase for age. So some of our members that are 75 plus years and then obviously 65, they are starting to finally get vaccinated on their own and doing their own registration, which is not coming on the fire department side, which still leaves, obviously the younger crew members still vulnerable. So.
And one thing I had assumed, and again, probably incorrectly, I figured, like Chief Lombardi, when you had reached out, I was like, all right, so they just changed it to ages. I mean, isn't the fact that you haven't been vaccinated this far, isn't it moot because you're going to get in there because everybody falls into a certain age. Like I'm 47, so whatever, I got it sometime in March. But that's not the case, you're saying.
No, absolutely not.
And explain, because that's the age, just repeat it for me. That's because the age of your firefighters is
right. So as so prior to Monday, there was phases. There was different phases for certain personnel to go. That being said, on Monday, the governor had announced he had rolled out basically a new plan where basically it's all age driven. So, 2 weeks ago, we were at the 75 mark, 75 years of age. This week, I believe we're still at 65. And I want to say within 10 days, it goes to 55. So it keeps trickling down, but there's different stipulations. So as of March 1st, if you're, and I'm not knocking the teachers by any means, because I don't want to get hate mail, but March 1st, the teachers are eligible. So again, it's like different people are eligible at different times, but yet we still haven't even vaccinated all of our first responders.
And then Chief Glow down there in Derby, when Chief Lombardi said his number in Seymour of having just 4 vaccinations out of 100 or roughly, how now I know Derby's in a different situation.
Yeah, we're in a very different situation.
How many have been vaccinated down there? Do you know, or just roughly out of the whole department?
Well, when you look at the ambulance corps, I do not know how many actual members have dual designation as ambulance corps and fire department off the top of my head. If I was to hedge a guess, out of our probably 75 to 80 active members, I'll say about 20 have been vaccinated. And that's because of their dual responsibility as being part of being on the phase 2, when they open it up for EMS.
Now, so that's EMS, but some of those are like storm rescue where they could be
Storm rescue, yes, the storm rescue, which falls under the EMS umbrella, but still does firefighting duties. But yet they're still, they still have trained, they have all their EMT, MRT, whatever they have, but they fell under that aspect of it.
And this may be a stupid question, but I'll ask it anyway. Is there any sense
no question is stupid.
Well, thank you. I appreciate that. You should look at my Facebook page. But the 20 that got vaccinated, are they? I don't know if I go. I'm not leaving my basement right now, really, because of this thing. Because are they getting more work put on them? Do you think, or no?
Not to be honest with you. Everybody on this call who volunteers or who's a firefighter, it's not something that we do lightheartedly. So a lot of these individuals still respond who haven't had their vaccinations. They still show up and look at everyone on this call who hasn't been vaccinated. I'm sure if there was a tone that's dropped right now, we're all jumping off and we're leaving you here by yourself, because we're going to respond regardless of if it's an MVA, actual structure fire, whatever, a lockout, whatever it is. And like Chief Levy and Chief Mike said, is that the fact that we respond we're first contact regardless of a CO call. If we go to just a investigation of smoke, anything to any residents, and yes, we do have a designation on the radio that says 49 Charlie or 49 not. So we have somewhat of a walking point, but we do not know if that's still an actual COVID house or not. But yet we're still going to take every single precaution of masking up and ensuring that our members stay safe. So again, yes, you still see people making the ambulance calls and making the fire calls. We haven't had any, any lack in responsiveness. I think we've actually had an uptick in responsiveness as well, because people still want to be part of what they have signed up to do.
Okay,
I think
gotcha.
kind of the same thing in Seymour. I mean, we're still getting trucks on the road and we're still getting guys, but I will say, some of my older firefighters, and I mean that respectfully, they've reached out to me and said, hey, I love the department, but I'm not coming out.
And I respect them 110%.
Yeah, I mean, I can't argue that. What I mean? If they feel like they're safe in their home and, only going out limited, to get groceries or whatever, why should they be, of an older age, why should they be going to these calls where they could potentially be exposed and then they're not vaccinated? I can't argue with that.
Right. And then they take the chance too, as well, because a lot of us have, real career jobs that we do.
Yeah.
And if, we put ourselves in harm's way of potentially getting exposed, doing a volunteer service, and then, we end up getting in contact with somebody that has it, we test positive, and then we lose time at work as well. So
we take a lot on our shoulders, and I think, there's a disconnect between, I hear it a lot where individuals in on the Board of Aldermen's taxation, and they always use that statement, "Oh, they're just volunteers," and that resonates a lot deeper than just with your own town. You got to look at it up at the state level as well, because a lot of people have that designation, "Oh, they're just volunteers. They don't need the same level of protection that should be for regular paid firefighters," was totally wrong, because when a fire happens, it does not designate if someone is a volunteer or if they're a paid firefighter. It's going to treat you the same way. So there's a lot of people that look down upon the volunteerism as, they don't need this, they don't need that. And I hope that's not the issue that's prohibiting most of these individuals from, getting vaccinated, because that'll be a crying shame.
And again, and I'm sorry to repeat myself, but it helps me understand or ask the same question again. But there's been like if no one's come down and explained to you, Chief Lombardi, from the state level or a representative from the Department of Health or Naugatuck Valley Health District to explain why this is happening the way it is, why volunteer firefighters are not being included in the vaccination rounds.
Yeah, I mean, I've reached out to the state, to the Board of Health, and they told me they took all my information down. They took down my concerns, my email, my phone number, and they said, we'll get back to you in 2 to 3 days.
When was that? When did you reach out?
A week ago.
A week ago. And then if no one else has anything to add, I wanted to ask one more.
Yeah, and we've been, we have a safety committee in Seymour where we meet weekly, and it's usually, all the department heads, and we just talk about things that are going on, any, issues, do we need supplies, stuff like that, and we've had representatives from the Valley Health come to those meetings, and, they're I don't think they're not working for us, but there's just some type of disconnect, and, there's a lot of plans that we talk about, and, they're not happening. And, part of it is, again, the governor changes his plan. When he rolls out a new plan, everybody kind of has to adapt to that. But
and there was no advance notice, right? From what I read, I mean, I don't know personally. I don't get anything from anybody, but there was no advance notice on any of this.
I did not know about the governor's conference on Monday. We have been doing these state calls where everybody in the state can log in via by phone and talk to, Lieutenant Governor, people from the Board of Health, and there's a lot of interesting facts on that. But the problem is that it's very difficult to, you're kind of pulling from 169 towns in the state. So, if someone in Bethel has a question and they hit the button before I did, I get put in the waiting room. So it's tough to get on there and get questions answered. And a lot of times, a couple times where I know, like EMS Chief Kelly has asked some questions. It was, well, we'll get back to you. And it's a big circle because we're not there.
And then, if you would, Chief Lombardi, take me back to that incident you mentioned towards the beginning of this interview when you said you responded to a call, a car accident. You said, take me through that, where someone was COVID positive.
Yeah, I believe actually Chief Van Wert was the first one there. I think he's on this call.
Is that FD3?
Yeah.
Yes.
There he is.
Dave, you there?
He's off mute.
FD3, this is God.
Sorry, I just walked into my house, so it went from no Wi-Fi to Wi-Fi, so my phone cut me off. Apologize for that.
That is no problem.
Good recover.
I'm Eugene Driscoll. I'm Eugene Driscoll from the Valley, Indiana. I was just asking, Chief Lombardi had mentioned at the beginning of this interview this incident that sort of kicked me in the shins, where you responded, or Seymour Fire Department, and I guess EMS, probably police too, responded to an accident where someone was COVID positive. Like, when was that? If you could just take me through what that was like and how it happened.
Well, I believe, if my memory serves me correctly, it was a week or so ago, and basically it came in as a motor vehicle accident. we got on scene, and as the crews started to approach, the lady stated, be advised I'm COVID positive. And PD actually approached me as well and said, hey, just to let you know, the lady's stating that she's COVID positive. So then I had an engine and a rescue responding to that. And I just basically told everybody, stay in the apparatus. If you have to approach the vehicle, with your mask on and regular proper PPE or precautions and everything like that. And then we kind of just stayed back. Fortunately, it was an MVA where the car kind of drove on a snowbank. So there really wasn't any like fluids down because the snow absorbed them all. So we were able to stay back. But again, I just kept everybody back. And if they had to do patient contact to assist EMS, it was basically masks on, normal PPE precautions that we do, which is gloves and gear and everything like that. But like Chief Lombardi says, it can happen at any time. And, any call we go on, we can go on a call in 20 minutes and someone could be like, it's a CO call. And we walk into people's houses and they're like, oh yeah, by the way, I got COVID. So that's one example. I mean, all the chiefs on this meeting right now can go through examples from the last, since December and even before that, but, since December and everything like that. Every time we go on a call, we don't know what's going to happen to that on that call or what that call is going to entail or what the people have.
And then just going back to that particular call, I mean, it seems like whenever I interview any of the firefighters or other responders in the Valley, there's always the training just kicks in and you do what you have to do. But do you get angry? I mean, because here you are and this issue is going on. There's only 4 members of the department that's received the vaccination because of the rules from the state. Does anger cross your mind or frustration in the moment?
Definitely frustration, but then like you said, our training kicks in and we all know we have a job to do regardless of the hands that are dealt with us, lack of vaccination. We're still going to do it. Like Chief Glode from Derby said, we're still going to do what we need to do. At the end of the day, anybody that, gets into the volunteer fire service because they want recognition all the time or anything, it's the wrong line of work. We're there to do a job. We'll do the job. And, amongst ourselves, we might, express frustration and anger and, express frustration and anger to the people higher up than us that can possibly do something about it. But at the end of the day, we're still going to do our call and still get the calls done because that's what we have to do.
Okay. And
Eugene-
what was
Eugene,
your I just want
Eugene,
his first and last name before we move on. I just wanted to get it's just his
Sorry,
FD.
Assistant Chief David Van Wart, VANWART.
Okay, thank you.
No
Go ahead,
problem.
Chief Lombardi.
Eugene, and the thing, just to kind of echo what Chief Van Wert said, the thing that is even more scary is when you're going into these houses and they don't tell you anything.
Right.
How about if you're in the 5-day grace period, they don't even know they're sick yet?
Right. And these are all things, and I know the Naugatuck Valley Health District thinks I'm kind of ranking on them a little bit, and it's not the point that I'm ranking on them. I have some valued concerns that we are not vaccinated yet. I understand everybody has a job, and I know that the Valley Health has a laundry list of rules that they have to follow by the governor. I think that with all the pull that the Valley Health has, they're the second biggest health district in the state, from what I understand. How is it that there's not more of an open line of communication with the state to fix some of these issues, fix some of these problems, it's not just Seymour. I mean, there's a lot of firefighters in the Valley. I mean, I would venture to, between, Naugatuck to Shelton, I would venture to bet there's well over 1,000 firefighters. I don't know how many of those haven't been vaccinated, but I would say a good decent amount. And I mean, we all work together within the Valley. If Ansonia has a fire and they need us, we go in there. If Ansonia has to come into Seymour, I mean, we all work together. And it's a real sad state of affairs to me. When you become a chief, and every chief in this room will tell you the same thing. When you become a chief and you put your hand up and you say, hey, we're going to do this and I'm going to keep my people safe. Where are we right now? we're not vaccinated. This is not a new thing. I mean, the pandemic has been going on for almost a year. There needs to be better answers. We need to keep our personnel safe. I mean, it's the bottom line.
Okay. Those are all my questions. Yeah. Let's throw it out if anybody else just wants to throw
Sure.
anything in there.
Deputy Chief Edwards from Seymour Fire.
What's
Listen,
your first
I'm
name?
sure, Chris.
Chris. Okay.
I'm sure all the chiefs on this screen and the ones that couldn't be with us tonight will agree that I think we're beyond the pointing the fingers and the blame. It needs to be fixed now. Like Chief Lombardi said, we all took an oath to protect our guys. I can speak for us in Seymour. Even the service chiefs haven't been vaccinated. The whole department as a whole is being very unsafe right now. No lack of from us. You know, we're on this thing every week fighting on our safety committee. Mike's taking the brunt of it. But the time has come. The time has come to vaccinate the firefighters in the valley. We go into people's houses, as been stated before. I don't want to, kill a dead horse here, but it's the unknown that scares me. It's not the 49 papas that we're going to. We're getting a heads up. It's not the person that admits it. It's the person that doesn't know they have it, and we're in their house. Then we take it home to our families. Then they take it to their friends or their job. It's a chain reaction, all because we're out here doing a job for free. So the finger pointing's done. The blame is done. It's time for the state, Valley Health, Naugatuck Health, whoever may be pulling the strings to get it done.
I'll second that.
Yeah, click the motion, man.
Listen, take it from me. I had it in the worst way, and I was down for 14 days. It's a bad virus. I'm not knocking it. But I am saying our guys, from a leadership point of view, they need to get done. Enough's enough.
Okay. All right.
I'll
Those are
take
all
the
my
heat on that
questions.
one.
I'm sorry. Go ahead.
I said, I'll take the heat on that one.
All right. Does anybody else have anything else or anything else they want to add?
I just want to, my name's Alex Hortis. I'm an assistant chief in Ansonia. Sorry, I'm a little late. I had previous meetings and I have another meeting I'm late to, but
What was your
Didn't hear
last
the first-
name, Alex?
I'm sorry, sir.
Your last name?
Horjitson, HORJATSCHUN. I was just going to make a comment. I'm sure it's already been addressed, but we've been putting lists together to try to get our firefighters vaccinated. And like Chief Lombardi said, we took an oath to protect our men, and that's what we're trying to do in Ansonia. We had a list together. We were trying to get our firefighters vaccinated, and the punch in the gut was when I heard the governor the other day make the announcement saying that essential personnel are no longer priorities, and we're basing it all on age. And it's just a punch in the gut because, like these chiefs have said, we put our lives on the line. We don't know who we're going to bring this stuff home to and who we're going to spread it with, and we don't know what we're walking into. And just because we're firefighters doesn't mean we only fight fires. We go to other emergencies, seal alarms, car accidents, and then we're being told we don't do medical calls. Well, yeah, I don't go to the heart attack patient, but we go to extrications, we go to car accidents, we go to help the ambulance with obese patients to lift them up, to put them on their stretcher. So we do some sort of medical calls. We are exposed, and we're just taken for granted. And I mean, like I said, to hear that from the governor was just a punch in the gut. And how am I supposed to protect my members? And when now they're going based on age, and I tell the guys I'm sorry.
Yeah.
So that's my 2 cents.
I appreciate that. Thank you. And who's been represented here tonight? So we had Derby, Seymour, Ansonia. Mr. Pollack down there in the corner. Did you have anything you wanted to say, or which department you're representing?
I'm also an assistant chief in Ansonia. I came on, just to hear what was going on, and my frustration echoes everything the other chiefs have talked about. We haven't stopped since COVID started, going into people's houses, dealing with everybody, and to be singled out the way we've been because we don't do medical calls, I think it's just ridiculous. I think it's always been, excuse me, a problem with the volunteers is that, you cut our budget, you take stuff away from us. The people still know when they call 911, we're showing up. We don't usually, this is very uncommon for the volunteer service, to actually get a chance to speak out and do this, because we just usually keep our heads down and do our job. But with this, Chief Edwards mentioned, your families. He's got young kids, to have that and the possibility of getting exposed in a volunteer position and bringing it home to your family and something happened, and that it's just, what we continue to do it. And for them to look down and just say, oh, volunteers, it's very frustrating. Very frustrating.
And then the idea in Ansonia, or the feeling in Ansonia, which has been, I think, expressed earlier, it was that you thought, okay, I mean, before Monday, prior to the governor making his announcement, you would be vaccinated sooner rather than later. Did you have any idea as to when you thought you were going to go in Ansonia?
We had some of our guys already added to the list based on priority calls, and I was being led to believe that sometime in March I was going to have the rest of my department, or a good portion of my department, vaccinated. Only to find out that that's not going to happen, because now they don't meet the age criteria, and according to the numbers, it looks like they're going to be more in May based on the governor's ages.
And do you have any idea how many active firefighters there are in Ansonia, and roughly how many have been vaccinated thus far?
I would say there's probably about 100 to 110 guys that are active. And I uploaded the list of, I had the list uploaded, which was 35 members.
35 were to be vaccinated?
35 were uploaded that they had the choice to get vaccinated. Whether they accepted it or the health department allowed it to is beyond my knowledge. Meaning the health department might have canceled some of those scheduled appointments, or they might have not allowed it, but 35 guys were uploaded into the portal.
Okay, so and that change happened Monday. We don't know as of Monday whether, because they had been uploaded before the governor changed it, just so I understand.
Yes.
Okay, gotcha. All right, those are all my questions. I'm going to try from a housekeeping perspective to try to write this story and get it done by tomorrow night. So I want to thank everybody for coming on, and let me just stop the recording, make sure I don't mess